Good evening, everyone. Thank you for inviting me here this evening to give an annual report. We're going to try to do this earlier in the year in the same format we did a few years ago, and with COVID, everything got put to the side. So I'm pleased to bring to you a report from Newtown Ambulance for this year. What's been going on with us, where we're going, and also how this kind of relates to the budget discussion later on this evening. You have that presentation slides. There we are. Okay. All right. We can go to the first next slide, please. I'm going to first give a shameless plug for our annual subscription drive. This normally is in the mail by now, but in discussion with our company that handles this and our own internal concerns with the mail and the election, we're holding off the mailing of this until about the second or third week of November. You can, anyone, a township resident or over in the borough, can go on our website and actually subscribe for 2021 now. That is up and live and running. But when it does come in the mail, the envelope's going to look like this, and it is not junk mail. Last year, we were pleased, last year, I said from 19 to 2020, which just ended the campaign, we actually had an increase of 2.8% in donors. We think part of this is because of the technology we use with the new website, as well as we purchased a new mailing list this year. Our mailing list was about 7 or 8 years old and patched together. So from the county, we purchased a new property tax map list, and we were able to update our mailing. So we appreciate everyone's support in last year's subscription drive. An important note with the subscription drive is, while it helps us, it also helps anyone who joins, because if you lose your insurance or you have insurance with high deductible, we write off your balance or write off your entire bill if you don't have insurance or have one of the high deductible plans like we do. And there's more information about that on the squad's website. Okay, we can go to the next slide. Since there may be a lot of new residents and a lot of people who really don't know what we're capable of, I'm going to just run down quickly some of our capabilities. We have a fleet of 8 ambulances. 3 of them are basic life support, which are equipped at the level with just 2 EMTs. We have 1 basic life support specialty ambulance, which is the bariatric unit. There's a picture of that in a couple slides coming up soon. And we have 4 advanced life support units. We have 5 wheelchair vans. While they don't pertain necessarily to the township, I'm going to discuss why I'm mentioning the extra capabilities in a couple slides. We have 2 that are primary for the township, 2 that are ready reserve backup ambulances, and my vehicle was just replaced this year, which is in the process for licensing it to actually be a quick response vehicle to also serve the township. Our organization is a member of the Regional Task Force for Active Shooter Incidents. We have our in-service time with certified people is 88% a month for the task force, and we have specific staff members that were credentialed through 3 training sessions that the county had put up, along with about 7 or 8 other county squads that are in the task force. And what that means is, if there should be an incident anywhere in the county, we're one of the units that's going to get automatically dispatched. So we're proud to be part of that plan. We're also active in the Bucks County EMS Chiefs Association, the Bucks County Medical Advisory Board, and the EMS and Public Safety Communications Advisory Board. And going to the next slide. Now, while some of the extra vehicles I spoke of in there are used on our transport division, the other side of the fence, we do put them into play when there's a major incident in the county. So in 2019, and again, I haven't presented since 2018, we participated in 2 nursing home evacuations due to severe weather. One was the Crestview Nursing Home, where within an hour we sent 4 ambulances over there to assist them without degrading our existing service to the township. And a week after that one happened, Pediatric Specialty Care in Plumstead Township had an electrical issue from a thunderstorm and had to evacuate their kids to Doylestown Hospital. We sent 3 ambulances and a wheelchair van up there, ambulances for the people and a wheelchair van to move equipment to get those kids out of there. So we are part of a larger regional EMS system. There's also been several other times within the county since then where the county's been so busy due to either an isolated incident or a weather incident where any extra units we could put on service have been relocated to other parts of the county. Most recently, during the tornado that struck in Doylestown in August, we went from having 2 ambulances in service to 6 within 15 minutes. So we pull our people that are doing the routine transports off of those details, log them up for municipal service, and send them wherever the county wants them to go. So we are rich in resources for not just our own township, but others around us. So in the last 5 years, and most of you on the board have known me, I came to the squad as chief in 2015, and we've come a long way. And we've really, in the last 2 years, some of the changes have really been escalated. Especially this summer, Brian Beecher, our battalion chief, who used to accompany me to some of these meetings, he retired to South Carolina, and we promoted an assistant chief, a battalion chief, both from our ranks of paramedics, 1 captain and 2 lieutenants. Even though we promoted some ranking officers, we actually are saving in payroll about $30,000 a year because those officers are required to do time on the schedule on the ambulance. And prior to that, the chief officers weren't required to do that. So by them getting on the ambulance a minimum of 24 hours a week, they're still part of the schedule. We're not using those hours to fill somebody else in with there. And they also help to fill out vacations, call outs, and other special events as well. So we've actually got cost savings by, even though we were able to expand some of the command staff. We've really increased support with municipal services, notably, and I think a lot of people aren't aware of this, we provide Newtown Emergency Service, Glenn's department, Chief Forsyth's department with all the medical supplies and medical oxygen. And anytime they need something, they come right over and get it. Early on during the pandemic, when his department as well as the police department needed some PPE, we had enough cash to start to spread that around a little bit until we started getting distributions from the county. And we have spent, since the pandemic has kind of waned a little bit, we've been spending the last couple months building up another cash. So we feel very well prepared for this next wave that's going on right now. We can go to the next slide under statistics. The next slide for statistics. So the NFPA standard for an ALS unit to arrive on scene from time of dispatch is 9 minutes. Bucks County statistics, and the ones that you usually get every year from the Emergency Health Service Office, give you statistics from time going en route to time on scene. So using that statistic, our response time for a paramedic unit is 5.55 minutes. If we add the dispatch time, where it's 7.55 minutes, so we're still well under the national minimum standard of 9 minutes. Basic life support is at 6.1 minutes, and the time for BLS is always higher because we don't use lights and sirens or termed emergency speed to respond to basic life support calls, and that's a county regional protocol. So unless the crew deems based on the dispatch information necessary, they'll respond at normal speed to go into those kind of emergency calls. 79% of our calls are during the day from 6 a.m. to 6 p.m. and only 21% of them are from 6 p.m. to 6 a.m. And these are 2020 statistics through October 24th. 92% of our responses are here in Newtown Township, with the other 8% making up other municipalities, including Newtown Borough. There's a small amount of Upper Makefield that we cover up along Creamery Road and the Enclave neighborhood, as well as a small section of Lower Makefield. We run mutual aid into Wrightstown, Northampton, and Middletown Townships. We also do some mutual aid into Upper Makefield. And we should note that Upper Makefield Township does provide us a small amount of compensation based on the area that we cover in Upper Makefield every year. We receive a very small amount for that. So what's really been the impact this year? So 2020 started out to be one of the busiest years ever for EMS in here for our organization as well as in the county. We were trending to be almost 400 runs more than the previous year. And then since COVID happened, we're trending to be 500 runs less than last year. And last year wasn't exactly a stellar year to begin with for the number of calls. At one point during the pandemic, we were down about 60%, and that's pretty close to what the countywide average was. EMS organizations saw a sharp decrease in EMS runs. Right now, we're down still about 30% of our monthly call volume over last year. And as you can imagine, that's had a financial impact because we haven't cut services. Since 2017, our overall EMS revenue is down by $400,000. And this is caused by the loss of our territory in Northampton Township. And I compare the loss of that section of our coverage area to if the police department were to lose Wrightstown. It's a comparable percentage of our overall operating picture. We compensated for that by grants for equipment, by eliminating unfilled positions, and moving other things around, restructured some things, and we've had the resiliency to be able to change to meet that challenge without impacting our service to Newtown Township. There's also been a decrease in call volume overall because the demographic has changed. So the average patient age continues to be lower than it was in 2017. So our average patient age back in 2017, I think that was in the written report from back then, was 69 and a half, and we had 30% of our patients over the age of 80. So as you can imagine, a few years later, that population has moved on, and we've seen a younger population of patients. What we are also seeing this year is a sharp increase in psychiatric calls, largely due to the pandemic. We're also seeing a large increase in sick patients. So the acuity, meaning how sick somebody is even though we're not running as many calls, we're seeing patients with far more complicated, far more serious medical problems. And that's directly attributed to the fact that people were afraid to go to the hospital, afraid to call 911 earlier, didn't see their doctors. Telemedicine didn't really start to catch on until a little bit later in the year, this summer with a lot of people. And there's statistical evidence countywide, even the health department agrees that is a valid statement. So the COVID operations, we along with many other EMS agencies were very fortunate to have received the Paycheck Protection Loan. We anticipate that will be forgiven under the guidelines of that. It was 100% used for payroll. That'll be recorded as a grant essentially once we close out the year. We also received $17,000 in a Medicare stimulus payment. The painful part of that is that it came with a stipulation that we cannot balance bill any patient, no matter who their insurance company is, if they were a COVID positive patient. So there were EMS agencies in our region that actually sent the money back because they could not afford to not balance bill. So this was a small amount of money, but not knowing what our financial picture was going to be like, we accepted it and are tracking those patients to ensure that they're not balance bill. 3 of our staff members tested positive and were in quarantine, but the good news was that was not an occupational acquired infection. It was contact traced to outside the workplace. We did honor the voluntary compliance with the CARES Act of paying them for their time out without charging them paid time off, because we were told that FEMA would reimburse us for that, only to find out that FEMA decided not to reimburse us for that. So we shouldered 100% of the salary expense for doing that. Public safety and hospitals were exempt from the CARES Act mandation of that, but we felt the right thing to do was to continue to pay our staff. Next slide, the grant funded equipment. We've been real busy with raising money. The last 2 years have been very successful. This summer we received a COVID grant from the Rotary. In 2018, with the help from Representative Perry Warren, we received a $112,000 grant to buy a 4-wheel drive ambulance. And this year, and I've said year over year, standing before you about our bariatric ambulance, myself and the chief of the Middletown Emergency Squad worked with County Commissioner Marseglia, the Emergency Health Service Office, and Bucks County Emergency Management to get federal funding for replacement ambulances for our bariatric service. So that big yellow ambulance, us and Middletown receive identical ambulances from the federal task force funds that respond anywhere in the county for bariatric patients. And what's really important about that is we saw a doubling of those calls during the height of the pandemic, because that population is one of the most vulnerable to COVID. So at one point our bariatric ambulance did 8 runs in a week. We never even saw 8 runs in a month. So it really had some time this year. That ambulance that we received through the county was actually a 2015 model, but it only has 36,000 miles on it. It's going to be a 10-year ambulance for us. We received $60,000 last year from a private resident in the small section of Upper Makefield that we cover, which funded that ambulance, which is pictured there. This past year, thanks to Micah pointing me in a direction of a DCED grant, we received $4,995 for a secondary bariatric stretcher. And we have the various fire commissioner grants that are awarded to us year over year. The second 2020 fire commissioner grant was one that the state added on this year just for COVID. Some quick statistics for COVID. For our 911 service here in town, we transported 18 confirmed COVID positive patients. And while again, our transport service doesn't really apply to the township, just an interesting statistic, we transported 241 COVID positive patients from a hospital to another destination. That's a regional service, so there was quite a bit of COVID in our hospitals at one point. COVID, as I'm sure that you're tired of hearing from every corner of the world, it's increased our operating budget significantly. Our medical supplies, we are overspent by 67% from our original budget, as of course we could never have predicted that this occurred. A lot of that's going to be made up through that COVID fire commissioner grant that we just got awarded. There are other things that we're incurring, like COVID surcharges. Our medical oxygen delivery service levies a COVID surcharge. Medical supply costs are through the roof for the same things that we used to buy. For example, 2 nights before the pandemic really hit the news, I ordered 200 surgical gowns for $45. In July, I bought 500 surgical gowns for $1,500, the same exact item. We're also seeing delayed insurance reimbursements due to many carriers having staff work from home. And it's been very hard to get through the insurance carriers on the provider side because their agents are working from home remotely. And we've seen delayed reimbursements and mishandled claims because of that. So that's really hurt the regular revenue cycle, but because we had the Paycheck Protection money to cushion us, it's been kind of working out. Next slide, please. On the legislation front, I've been very outspoken to a lot of our elected officials concerning the state's support or lack of support of emergency medical services. And one of the most damaging things that we are faced with right now is House Bill 1862. So this bill is designed with good intention to fix a problem with surprise balance billing, and I'm sure everybody's really familiar with that with insurance. However, at this moment, the bill as written does not exempt emergency medical services. What this bill does is it puts 100% of the control in the hands of the insurance company to reimburse us what they feel is the fair number, and then on a patient-by-patient basis, we have to go to arbitration to dispute that. And some of these insurance companies are kicking around numbers like Medicare plus 10%, 90% of Medicare, and Medicare doesn't even cover our cost to treat a patient. So this is a very dangerous piece of legislation. There are several amendments on the table right now to exclude EMS from this. There are several states in the United States that passed this legislation but carved out emergency services. So we're really hoping that it passes with an amendment that excludes us, because this will, without a doubt, cripple EMS throughout the entire Commonwealth. We will be no different here. Next slide. On the finance piece, our revenue comes 89% as fee for service. 5% of it's from our subscription drive. 5% is from tax revenue. That's up 1% since we went to the EMS Millage as opposed to a few years ago, and 1% from other private donations and grants. In the past, I've always spoken publicly about the insurance reimbursement as being the issue, and while that is still a problem, it's not 100% of the problem. And speaking with a lot of my colleague chiefs around the county, the cost is the 24-hour state of readiness, and it's why other 24-hour departments you have in public safety, the payroll number is so high, because we always have to be here. And while insurance again is a big part of it, the cost of that state of readiness has a cost, and it has to come from somewhere. And there's not a doubt that we are here when you call us, and even though we don't run a lot of calls certain times, especially now, we still have to staff people around the clock to be able to get those ambulances out the door within 2 minutes. This year, we're shockingly seeing a 10% increase in employee health insurance. And I say shocking because last 2 years, we saw 3% reductions from Blue Cross year over year. And our group has suddenly popped up 10%. We also had a lot of staff turnover because of uncompetitive wages, and also COVID. We saw 4 people quit and not return to EMS. So we incurred a lot of overtime costs this year because of that. We're looking at replacing an ambulance, a 10-year-old ambulance. We're looking at about $120,000 for that in 2021. And we are faced with requirement to replace our 4 cardiac monitors this summer, which will be a cost of that's actually incorrect. It's $128,000 total, not $128,000 per unit. That's my mistake. $128,000 total for the 4, and then it is $28,000 total for the maintenance plans for the 4 of them. The cardiac monitors we have are end of life in 2022. Our lease is up in 2021, and we were having trouble getting parts for them as is, even though they're still supposed to be supported another year. The medical device manufacturer, Philips Medical, is having trouble getting parts. The good news is we had a workers' comp reduction of $16,000. So that was a little bit of silver lining to the cloud. Last slide. Okay, so we have an EMS millage, and when this was put into the last budget, or 2 budgets ago, we were very appreciative of the change that the Board of Supervisors made. That was truly life-saving for us, and we feel good that it benefited the township by putting the LST money back into the township's budget. No EMS service anywhere can survive without municipal funding. No EMS service can survive on just fee-for-service revenue, especially since its unstable nature of insurance reimbursements and the constant changing rules and policies. Other things that have really hurt us is the Emergency Medical Service Operating Fund, which is funded by the CAT fee when you get pulled over and get a ticket. About 15, 20 years ago, Bucks County used to see around $200,000 or more distributed amongst all the EMS organizations, and we used to make capital purchases with this money. We'd buy cardiac monitors, stretchers, money towards an ambulance, and that has dwindled to barely $40,000 for regional projects only. In 2021, because of COVID, the state has told us that there'll be an 11% reduction in MSOP to Bucks County, and the county commissioners are going to make up the difference from the county's budget for that. And that's mainly because there were the reduction in moving violations this year because no one was driving, so they're not collecting the fees and the fines, so the MSOP fund's dropping even further. There's no statewide funding for EMS, and there's no dedicated EMS grant. While we're very appreciative of the fire commissioner grant that we receive year over year, it's $50 million, $6 million goes to EMS, $44 million goes to fire. And when I discussed this with the Ambulance Association of Pennsylvania, their response was that's because that's how that particular grant is legislated. So today there is still no dedicated EMS grant. And grants like that are great for making capital purchases so that we don't have to strain or take loans. I hate debt. I hate taking out loans. So we look for all these grant projects that I've gotten in the last 2 years to try to do capital improvements on that, because without having to take a loan, get it with a grant, it puts us 5 years ahead. So I can ask you as a Board of Supervisors that when you go to the Picado meetings, and I know that a lot of township officials around the county discuss this, well, it's in the township code to provide for EMS. Some of this should get pushed back on the Commonwealth, because the mandates, our protocols, our licensure requirements all comes from the Department of Health in Harrisburg. And a lot of the equipment we carry, which we agree is great for patient care, a lot of there's mandates on there, and certain drums that we're now purchasing that we have to buy, and we can't fund that from billing a patient. For example, when we bill a patient, we're billing advanced life support or basic life support, and that's it. So whether we use $1,200 in supplies and equipment or $300 in supplies or equipment, we're billing a flat rate plus mileage, and that's it. We can't do a COVID surcharge, a fuel surcharge. It's black and white with billing. A long time ago, we could itemize. Our itemized billing went away many, many years ago. So that is my presentation, and I'm happy to entertain any questions.
Chief, what would you like to see the township assist you in to help you in the future, either financially or emotionally? How can we help? Naturally, knowing that we're in a budget crunch also, but we love to help out as best as possible. So, any suggestions that you may have that we can entertain?
So I could never expect the township to take anything out of its own budget because there is no money to take. And I'm very plugged into what's going on here. I've been year over year at the meetings and all the budget meetings. This year we've discussed an increase of from 0.46 to 0.5 mils, which is the state maximum without a referendum for our EMS millage. And we very much appreciate that consideration in this current budget. It's a very small amount of money, but it's a starting point. In the future, and it's not just here in the township, I'm trying to have discussions with the borough as well, because the millage there is only 0.25, to look at a potential referendum for the future. Now, if it goes to referendum and you go to a certain millage, as you know, like you've done with the fire tax, you don't have to collect up to that amount. It just gives us that headroom. So another bite to us is the EMS, again, state regulated, 0.5 is the maximum without a referendum. Fire can go up to 3 without a referendum. So the fire service, and this isn't, pushing down any other service, it's just a comparison of how we're regulated. We don't have any headroom, and we have to immediately go to referendum to go above 0.5. And that's another disparagement of treatment and disparagement of funding with EMS statewide isn't viewed like the other public safety entities when we're really given bare minimum. So I think in the future we should have some discussions with the township and also with the borough about looking at appropriate millage, since we are providing 24-hour service to all the municipalities, the same level of service. Number of calls in each municipality isn't exactly where the cost is coming from. It's coming from the 24-hour state of readiness, and that needs to be a shared venture.
Any other questions for the chief?
Yeah, I have a couple, if you don't mind. So in our budget, we are getting up to 0.5 mils for this, is that correct?
That's correct.
So the increase would be just about $17,500, and my contribution would be $4 a year extra. But I'm also, I think, a member of your subscription plan.
Yeah.
Or at least I was. And so I'll continue to do that. But you mentioned the borough is only at 0.25 now?
Correct, and that's about $10,000.
That's about 10,000? So, and you mentioned that 0.5 mil is the maximum that...
Without a referendum, yes.
Without
a referendum. So if we wanted to go to 1 mil, this would have to be about question on next November's election.
Oh, I see. Okay.
And the residents would get to decide whether to support that increase or not.
Okay. Interesting to know. In 2017, I think, 2018, you came in with an annual report for 2017. I guess, can we expect, you went through a lot of details here, which I appreciate, but the annual report gives you a year versus year comparison. Is there plans to do an annual report for 2020?
Once we can close out the year and really take stock in what just happened, we'll provide an annual report.
Okay, that's great. And you mentioned there at that time about $123,000 received from local services taxes. And do you know what that would be in 2021?
I don't know, but I can imagine that the LST would be reduced because of the lack of people working. Mr. Lewis could probably more answer what that prediction might be, but that's all on the wage tax. So if people aren't working, or if other municipalities are taking that, for people that work in our township, you know, that's sure that number would be less.
So that's sort of related to the EIT in terms of people working.
I don't know if it's necessarily the same thing, but.
Not the same amount, I mean,
No, it's a tax to anyone working in the township. I believe it's maxed out at $52.
That's right.
$52,
That came
that's
from
the
the
$52.
Right, and
Oh,
also we do have a somewhat lenient for any senior citizen making below, I think, a $12,000 annual wage, of which they don't pay the tax at all. But we do collect the tax from other residents living outside of the township that may work in Newtown Township.
okay, good to know, thank you. Has there been any increases in calls involving drug overdoses? Because since the start of the pandemic, because I've heard in the news that there may be an uptick in the overdose of overdosing.
In our area, no. Meaning our response area, there are parts of the county where it was pretty brisk for a while during the pandemic, pretty significant amounts, but not pertaining to our response area.
Okay. And overall, how would you say the overdose problem is in Newtown maybe compared to last year?
I think it's pretty flat. I really haven't seen much change. There's a very small handful of cases of that.
Okay. I think that's all the
Really
questions.
sorry to interrupt, as far as EMS is concerned, there could be cases going on that were not called for, especially with the amount of people that have access to Narcan. But as far as our responses are concerned, year over year, since 2017 is when we started seeing them, because we didn't see many before that, it's been pretty consistent, low number, less than 10 a year.
I know our police department have administered Narcan. I forget exactly how many times, but when the police administer Narcan, is the emergency services, your squad also called to the scene?
We are, yes.
Okay. I think that's all I have.